Good afternoon, everyone. Welcome to our Wednesday webinar series. My name is Maria Maddox, and I will be one of your moderators for today. We are offering a unique perspective on foster care for this afternoon. Our today's presenter is Delreen Schmidt-Lenz, who is a social emotional consultant with 3 CFCs and is also one of our consultants with the EI training program. She'll tell you more about herself when she gets her turn. Facilitators for today are myself and Alyssa Jones, who is a research specialist with the Illinois EI training program.
Great. Good afternoon, everyone. My name is Delreen Schmidt-Lenz, and like Maria said, I am with the EI training program. And I'm also the social emotional consultant for 3 CFCs, Springfield, Effingham, and North City. I'm also the developmental pediatric consultant for the Effingham CFC as well. I've been working with children and families for 22 years. 19 of those have been in early intervention. I was the previous program manager for the Child and Family Connections office in Effingham, and throughout my years in EI, I've also been a service coordinator and psychological services provider, LIC coordinator, kind of run the gamut. I also am a licensed clinical social worker, and I'm an infant and early childhood mental health consultant. So I do consultation with mental health centers and health departments, early Head Start. And I'm also a prenatal bonding facilitator. I work with pregnant women in a private practice on the side for women to bond with their babies before birth. So that's just a little bit of background on me. I'm going to say a nice shout out to all of those whom I know. I was looking at all the participants who joined, and I know several of you on the webinar this afternoon. And for those of you whom I don't know, if you see me at a training or a meeting, please come up and say hello to me. I always like to put a name and a face together. So this afternoon, we're going to have a discussion about a unique perspective in foster care. And before we begin, I'd like to do another poll. So I would like to know, have you worked with a child in early intervention who is currently in foster care or has been in foster care in the past? So a yes or a no.
So folks, make sure you use that 4th icon there, the polling function, to let us know one way or the other. I'm going to circle it here on the screen so you can kind of see right in here. I'm not very good at drawing on the computer, but there you go. That's what we want you to use. Okay, we'll give folks a chance to respond there. All right, let's see what our answers are. So, Delreen, it looks like 51% of folks have currently worked with a child, has worked with a child that has been in foster care. There's a good quarter of the folks here who have not. So let's see how that affects your presentation. There we go.
Great. Thanks so much for that information. It gives me a lot of helpful knowledge. So here's a word on your screen, fostrian. It might be a new word to you. I'm kind of a history buff, so before I even start talking about foster care, I'd like to think about the 2 words. I think we use the term foster care just really casually and don't really stop to think about those 2 words. So I kind of need to know where words come from and how they come to be. So the word foster actually comes from the Old English word fostrian, and that word means to supply with food, nourishment, and support. So let's think about this. Do the children we have known in foster care, or just have a general idea of foster care, been supplied with food? I would say we would all hopefully answer yes. Have the children we have known in foster care been nourished? I think if we think about that in concrete terms, we most likely would all say yes. Going one step further, would you say that children have been emotionally nourished? That's something to think about. And the third part of the definition is the word support. So I'd like for you to take a few seconds and think about children in foster care. For those of you who have worked with children, in your words, would you consider that child to have received support? Today we're going to think really deeply about 3 different perspectives in foster care. I know you're all very busy in your personal and professional lives, but I'd really like to think collectively in the next 75 minutes. When we give ourselves the space to think about our work, we not only enrich ourselves, but we also help the families with whom we work. And it also makes us feel a little bit more connected, especially connected to the woman in Hawaii. I'm giving a shout out to Mary in Hawaii. We're all jealous of you, Mary. We're all in cold Illinois. All right, so today we're going to think about foster care in 3 different perspectives. We're going to think about foster care from the perspective of a child in foster care. We're going to think about the perspective of a foster parent. And then we're also going to think about the perspective of you as an early interventionist, really entering that microcosm of the foster care system. And within those 3 perspectives, we're also going to touch on the biological parents of children in foster care. So first, let's just get a shared knowledge about the history of foster care in Illinois. I warned you I'm kind of a history person. So back in 1849, Illinois child welfare actually began with the founding of the Chicago Orphan Asylum. It's now the Chicago Child Care Society. And its purpose was to care for orphans whose parents had actually died of bubonic plague in Chicago as they traveled west in search of gold. In 1905, the Department of Visitation was established, and it was established to visit children who had been placed in foster homes, to inspect these institutions, and to give certificates for the institutions that passed the inspection. And then on January 1st, 1964, the Illinois Department of Children and Family Services, as we know it is today, and I'm going to use the acronym DCFS, I think we're all familiar with that. January 1, 1964 was when DCFS was created by the Illinois legislature. So that's the history of foster care in Illinois. I think it's also really prudent for us to know about federal guidelines that affect children in foster care. So in 1974, the Child Abuse Prevention and Treatment Act, which is called CAPTA, was passed by Congress. And this act guides still what we do today. It gave states regulations on reporting abuse and neglect. So anytime we make a report to the hotline, it gave immunity for persons reporting abuse and neglect. And it also provided states some grants to help in developing child abuse and neglect prevention. So just another statistic, at any given time in the United States, so this is the United States stat, there are approximately 500,000 children in the foster care system. We're going to talk about the number of children in Illinois in foster care here in a moment, but I wanted to let you all know just nationally that's the number. I also think it's really important for us to stop and think about the goal of the Illinois child welfare system. And the Illinois child welfare system has 3 goals. The first one is to prevent. It's to prevent the unnecessary separation of children from their families. The second goal is to restore to their families children who have been removed by the provision of services to the child and family where the child can be cared for at home, of course without endangering the child's health and safety. And the third goal is to place children in suitable adoptive homes. And this is in cases where restoration to the biological family is not possible and or appropriate. I wonder how hard this is for us sometimes. To be quite honest, I have worked with many service coordinators and early interventionists over the years who really have had difficulty with the concept of family preservation and reunification, and I am included in that. I think it's really difficult for us to learn that a biological parent might have done something to harm his or her child, and it's a national and state goal to reunify the child with that parent. So that's where we have to stay connected and support each other. We have to try to be honest about our feelings because we definitely have a right to them, but we also need to recognize the goals of the DCFS system and work as professionals within that system. It's important as professionals that we all need to find a colleague that we trust to reflect these thoughts. You know, We all know with our EI credential that we have monthly ongoing professional development as a requirement to keep our credential, and this is a great benefit. This is the time for us to talk about these feelings and issues that we might be having with some of the families with whom we work. And also reflective supervision is something that's available through the social emotional component. I can provide to my service coordinators and early interventionists reflective supervision, and we're going to talk about this a little bit later in the webinar. So as we talk about this topic today, I'd really like for us to think about the challenges we have. And so to that end, I'd like to kind of ask you a rather sensitive poll question. How many of you have wrestled with your thoughts about a particular family involved in DCFS and DCFS's goal of family preservation and reunification? So I'm just wondering.
So
how many of you?
Use your chat box, sorry, not your chat box, your polling function there on under your participant, the fourth icon, and there should be a yes or no question there. So we'll give folks a chance to respond to that. All right. And we'll give folks a few more seconds before we post results, okay? Looks like the vast majority of you, as you're responding, have had these thoughts and wrestled with these issues. I'm sure that Delreen is going to delve right into some of that. So, Delreen?
I definitely am. Thank you. First of all, thank you for your honesty. I appreciate that. And I have shared those feelings as well. So, since July 1st of this year, of 2014, actually last year, 14,747 children have been placed in foster care or relative care in Illinois. So I was just thinking about this. I think we can all picture what we were doing on July 4th. Wasn't that long ago. Since then, 14,000 children, over 14,000 children, have been placed in foster care in Illinois. And also just to give you a frame of reference, I went back and looked at statistics for the last several fiscal years, and at the end of each fiscal year, I looked back since fiscal year 10, Illinois has had just about 15,000 children in foster care at the end of each fiscal year. So that number has remained constant. So of the 14,747 children in foster care since July 1st of 2014, 5,916 of those children were aged 0 to 5, which is obviously our population. And also, looking at gender, 6,964 of those children were females and 7,780 were males. And just thinking about ethnicity, 7,496 of those children were African American, 5,866 Caucasian, 1,000 Latino, 272 were unknown, meaning that it wasn't documented at the time that they were in foster care what ethnicity they were, 36 Asian children, and 17 Native American children. I'd like to talk about children with disabilities in foster care. Obviously, our day-to-day lives working is with children with disabilities. And I know I talked about CAPTA a few slides ago, which was the federal act about child abuse back in 1974. So that act was actually amended in 1988, and that's what you see on your screen. And the mandate was to study the incidence of child maltreatment among children with disabilities. I found some research for the Center for Abused Child with the Boys Town National Research Center. 14.1% of children who were abused or neglected had one or more disabilities. Also, children with disabilities are 1.8 times more likely to be neglected, 1.6 times more likely to be physically abused, and 2.2 times more likely to be sexually abused than children without disabilities. You know, children with disabilities aren't always necessarily in foster care because of abuse and or neglect. Sometimes biological parents feel that they are unable to care for children with a disability and actually relinquish their child into the system. My very first child in early intervention when I was 23 years old was a child who was referred to early intervention as soon as he returned home from the NICU. So I started working with that child. He was a month old at the time. He'd been in the NICU for about 4 weeks. And I worked with the biological parents, and it was 3 months of working with the biological parents. And I will never forget this day because I was sitting in my office and I looked up and the biological mom was in the doorway, and she looked at me and said, "I cannot take care of my son any longer." And just the impact of that, I will just never forget. I'll never forget that day. I'll never forget the feelings that I felt because I had been working closely with this family. And what came to pass was that the paternal grandmother actually took over and adopted this child. The biological parents terminated their rights and never really saw the child again. And so when I first began working with them, obviously I was working with the biological parents, and then I had to switch, and I conducted my early intervention visits with the paternal grandmother. And I was doing psychological services and developmental therapy at that time. And it was a really delicate and difficult situation to be in. And I know I talked about the support that we have with our colleagues in the ongoing monthly professional development. Well, back then there was no such thing as ongoing monthly professional development, but I was really lucky to have a supervisor whom I could talk to. And to be really honest, I had some feelings of anger with that biological mom. I was really having a hard time just figuring out why and how she could never see her child again. And so as I think about that child, and I was thinking about today's webinar, I feel so grateful that I did have a trusted colleague that I could really process my feelings and continue to work with him. And I worked with him until he aged out of early intervention when he was 3 years old. And of course, I'm not going to say how old he is now because that would also say my age. But it's one of those families that you just never forget, and it really made an impact on my professional career. All right, moving along. In 2007, the American Academy of Pediatrics actually released this clinical report, and it was called The Maltreatment of Children with Disabilities. This is the abstract of this report. And this report was put into place to urge pediatricians to really be alert to signs, excuse me, or symptoms of abuse in children with disabilities. And I don't know about you, but we have some great pediatricians and primary care physicians who work with children in early intervention. And I feel so fortunate that several of the physicians who routinely make referrals to early intervention and really work closely with us also try to recognize when parents who have children with disabilities might be feeling a little stressed, or they feel like there might be some concerns. I know several physicians in the CFCs that I work with actually reach out to the service coordinators and reach out to the therapists. And it's just one of those nice things that we can kind of work as a team, not even just early interventionists, but also the physicians to work together to make sure that children with disabilities are kept as safe as possible. So just a few more statistics that are important to you as service coordinators and early interventionists. 1/3 of all children entering foster care are 0 to 3 years of age. 15% of these children are under the age of 1, and 45% of all infant placements occur within 30 days of the child's birth. And also infants who are placed into foster care within 3 months of birth spend the longest time in care. So let's take a moment to pause and look at some of the comments and questions that you have posted up until our discussion right now.
Right, Delreen, I gotta tell you, I haven't seen a lot of questions that are coming in. So folks, take a moment if you do have any questions about the data that Delreen has shared. We'll give folks a few minutes. I know those statistics are sobering. And it's really sad to see that the children who are put in foster care at the youngest are the ones that stay in the longest. So I'm not seeing any, go back to the last slide, sure. I'm guessing you probably want that slide. So I'm not seeing any questions, so Delreen, I will let you take over. Oh, hold on. Mary does want to know if you have some information at what point are kids adopted in the foster care process? Okay. All right. Delreen, are you there?
I am here. So I'm wondering if she is referencing like the age. There is information about the length of time that children stay in foster care, and the mean or the average length of time that children stay in foster care is 29 months, and that's the average. So, and the end result could be reunification and or could be adoption. So I'm wondering if she is actually wanting like how many get adopted and how many go back living with their children. Do you think that is the question that Mary might have?
It might be, and then there's a follow-up kind of question about how long they are in foster care and before they can be adopted. I know that's going to be individualized, I'm sure.
Yes, exactly. It is individualized. And what I can do is afterwards, I was just looking, I don't have that statistic right in front of me, but I can definitely, I know when you send out the slide, I can look that statistic up because that is a really important statistic to learn.
Okay, so I think we will go ahead and move on, and we'll catch any questions that come up in between time at our next break. So just keep asking your questions, folks. Use the chat box to ask your questions. We'll have another break here, and we'll address them then.
All right. So we're going to move on to a discussion now about foster care and attachment. I'm sure many of you are probably familiar with the name of John Bowlby, who is up on the screen, from either a high school or college course in psychology. John Bowlby was a British psychologist who specialized in child development, and he kind of pioneered work in attachment theory. And he stated the following: the quality of the parental care which a child receives in his earliest years is of vital importance for his future mental health. Bowlby also stated that the essential for mental health is that an infant and young child should experience a warm, intimate, and continuous relationship with his mother or mother substitute in which both find satisfaction and enjoyment. Furthermore, Dr. Charles Zena, he is from Tulane University. Actually, Dr. Zena was just in Illinois 3 years ago. He was the keynote at the Illinois Association for Infant Mental Health Fall Conference. Dr. Zena has written the Handbook on Infant Mental Health, and Dr. Zena has stated infants are strongly biologically predisposed to form attachments to caregiving adults. So saying that again, they are biologically predisposed to forming attachment to caregiving adults. Also, Dr. Zena has stated that attachment develops gradually over the first several years of life based on the relationship experiences with caregivers. And he also stated, and I love this slide, Maria, you're so great at this. I love this picture of the little little child with the I have stranger anxiety, back off. That's great. I should buy that. But Dr. Zena also said under typical childbearing conditions, infants develop focused or preferred attachments in the second half of the first year of life, which is that separation anxiety, stranger wariness. So here's what this all means. Through experiences with caregivers, children develop expectations about the dependability of attachment figures. And these expectations are to provide comfort, to provide support, to provide things like nurturance and protection in times of need. And these experiences are so important because they're also predicative of children's social adaptation. These experiences also, number one, guide children's behavior in intimate relationships, and number two, strongly predict children's social adaptation. So just think about those things for a moment. Those are huge things that can affect children and all of us, I mean, throughout our lifetime. That's why attachment is so important. So what happens when an attachment may be interrupted, such as in foster care? We're going to begin to think about foster care from the perspective of a child. So I'm now going to ask you to put down your pens, just listen and kind of visualize while I talk about the perspective of foster care from a child. First, let's all imagine being a newborn. We are used to being in a warm space with our mother, knowing the rhythm of her heartbeat and recognizing the sound of her voice. We are born into a noisy world that is colder than what we're used to, and for reasons we cannot understand, we're hustled away from our mother because of something she has done. We don't understand what she has done or if it has affected us in a negative way. All we know is that we don't hear her voice any longer or smell her smell. We are all alone and soon held by strangers who are foster parents because there is no relative who is able to take care of us. Most assuredly, these foster parents are good people, but we don't know them and we miss our mother. We probably don't sleep well at night, and we might not eat well either. We might be fussy due to something that has been introduced to us in utero that is not good for our bodies. We might cry incessantly without being comforted by our foster parents or the service coordinator or the EI providers who try to hold us. We might just really miss our mommy and the other voices we are used to, whether it be our father, our mother's sister, our mother's parents, or her friends. Now let's take a moment and imagine being a toddler. We've been living with our mom for 18 months and reside with her and her new boyfriend of 6 months. There is a lot of noise and chaos much of the time, and sometimes doors are slammed and our mom and her boyfriend yell at each other. They also yell at us. Sometimes we're cold and sometimes we're hungry. Sometimes we wake up at night crying and no one comes to check on us. One night we hear loud noises and screaming. All of a sudden, strange people are in our house and our mom is crying and yelling. She is held by the strange people and taken out the door, and the same thing happens to her boyfriend. A stranger then tries to pick us up. We run to our room frightened. Where did they take our mom? The stranger picks us up and we try to hit and bite him. We want our mommy. It's dark and cold outside and we end up being taken to someone else's house. A lady opens the door and tries to hold us. We kick her and start screaming. She tells us this is our new house for a while. We miss our mommy. As the days pass, this woman gives us food, gives us a bath, tries to play with us, and makes us follow certain rules. We don't want to be there. We try to choke her dog. We go to the bathroom in our pants, and we break the toys she's given us. We don't want to be here. We miss our mommy. One day, a strange woman comes to the house asking a lot of questions about our behaviors and what the lady taking care of us knows about us and our mommy and our boyfriend. This strange woman, who is a service coordinator, says hello to us and asks us how we are. We grab her pen and run behind the sofa and begin writing on the wall. When she's getting ready to leave, we throw her pen on the floor and stomp on it. Why is she talking about us? A week later, 2 more strange women, EI interventionists, come to see us. They talk to the lady we live with and ask her questions about us and then ask us strange things, like if we can jump and if we can name pictures in a book. We don't know these people, so we lay on the floor and begin screaming. The lady we live with tries to get us off the floor and we spit at her. We miss our mommy. So thinking about these two scenarios, a newborn being in foster care and a toddler being in foster care, I'd like for us to think of some tips for the service coordinators and early interventionists who might work with a child in foster care. Number one, remember that a child in foster care is not only grappling with what might have happened to him or her, even though they may not be able to begin to process it, but that they have experienced loss. When a child is removed from her home and her biological parents, remember that this is a loss. They may have experienced something horrible, but even though they are very young, they can smell, they can see, and they can feel that they have been separated from their biological parents. In light of this overarching feeling of a child in foster care, I would like to ask both you as service coordinators and early interventionists to think about the word loss and possibly to even write it on some paperwork on the next referral you receive on a child in foster care as a tip. To keep that word in mind allows us to remember the feelings of the child from the child's perspective. When we think from the child's perspective, we also remember that behavior is communication. Most likely, that child did not stomp on your pen because he or she wanted to irritate you. That feeling of loss can make us all do things that we might not do if we feel secure. So here's a second tip. Tip number 2, service coordinators and early interventionists. When you go to a foster home for an intake and initial evaluation, if you don't already do this, which I'm imagining some of you already do, talk to the child. Say a simple sentence. Hi, I'm Susie, service coordinator, or Stephanie, speech therapist, and I'm here to learn more about you. Ask your caregivers questions about you and learn about how you are growing. I'm here to help you and your caregivers. I'd like to know your thoughts about this. I know some of you might be raising some eyebrows right now, but it's really imminent for a child who has experienced loss to be given as much information as possible. Children are keen. They are intuitive. For those in foster care, they might be extremely, extremely cautious. Talking to children, even if they really can't understand our actual words, can really give them comfort and knowledge. Children can understand and process the tone of our voice. They can understand and process our body language. And I have even said this to children as young as a few months old. I think we need to remember, never think a child is too young to be talked to. We do so all the time when they're in utero, so why do we forget when they're out of the womb? So let's take a moment. Are there any questions, any comments about the first 2 tips or just things from a child's perspective?
Okay, so Delreen, can you mute your mic, please? All right, just because we'll have an echo if we both have them going on at the same time. So there is a question here about that Christine asked earlier. Do you find any resistance from foster parents in getting children into EI services? And that may be something you're talking about later on, but if not, this is a question that's out there.
Okay. Yes, Christine, yes. So I will answer it right now. We're going to move into the perspective of foster parents here just a moment, but that's a great question. The answer is yes, most definitely, and I'm assuming some of the service coordinators on the webinar have also experienced this. The one thing about children in foster care and early intervention is that when children are eligible for early intervention and they are wards of the state and are a DCFS ward, the foster parents have to comply with what the early intervention team recommends. And sometimes that is really difficult for foster parents. And I always try to say, you know, we have to remember where the foster parents are coming from. They're going to and from court dates. I'm sure they have visitation, if not all, some of the time. And early intervention is one more thing that they need to add to their schedule. And I think it's all just in how we present the child's involvement in early intervention. It's a way for the early interventionists and the service coordinators to be a support to that foster parent. But yes, there definitely has been resistance resistance from foster parents, and we're going to talk a little bit more about foster parents here in a moment too. Any other questions or comments?
There are a few. So Mary Anderson would like to know why these children aren't automatically referred for social work services to help them with the loss that they're experiencing.
So many children who are in early intervention and who are also in foster care do receive social work and psychological and counseling and other services. It really depends on what part of the state you are in, because there are not always social work and psychological services providers in the CFC areas. I'm lucky in my 3 CFCs, we have some excellent psychological services providers, and when the service coordinators come back from an intake and during reflective supervision, something that I always do is I always make a point to talk to the service coordinators about the children who have been referred who are in foster care. And many times, the service coordinators have already thought about having a psychological services or social work evaluation, and so that's already been done. If that hasn't been done, or if there isn't a social work or psychological services provider, the other great thing about early intervention is that a lot of early intervention providers are very relationship-based, and so a developmental therapist can also provide support. A PT, OT, speech, anybody really can provide support. But the answer is there definitely can be a psychological services provider added to that IFSP to help with those feelings of loss.
I'm seeing some comments here that this is kind of a reminder then for service coordinators and or EI providers that when you've got a child who's going through this experience, that at least making the referral to get an evaluation. Debbie does wonder, Debbie and another person, I kind of lost the other name, but is wanting to know, is it expected to have a social emotional consultant on all foster care EI kids? So I think you kind of addressed that, but if not, that might be a little different spin to the question. So Delreen?
Sure. So I think every situation definitely is individualized. I don't think we can say that every child in foster care and early intervention is going to receive psychological services or social work services. But I think it's really prudent. Every CFC has a social emotional consultant, and anytime a provider or service coordinator wants to talk to the social emotional consultant about a child and family with whom they are working, I would definitely encourage you to receive support in that manner.
Debbie is wondering about when a child is in foster care and sees parents on the visits, how that affects the trust level, and does it confuse the child to the point that the therapists have to struggle. And on a related question, Tina is kind of talking about when a child that they're working with comes back from a parental visit, that there is sometimes regression in several days for them to recover. So those two kind of questions are related. So if you want to maybe discuss that a little bit, or if not, if you're going to be doing that later, I don't know.
Sure. The first question we're actually going to talk about here in a little bit when we talk about the perspective of the EI interventionist, so I might hold on to that one. And the second one, I think we have probably, those of us who have worked with children in foster care, we have probably all seen the effects of when a foster child has returned from a visit. And just thinking about, how difficult it is for children to process what is going on, especially when they have foster parents, they have biological parents, they have early interventionists. I go back to those 3 words that I say all the time, and I know those of you who know me know I say them all the time, but behavior is communication. If a child is acting in a certain way, doesn't always need to be acting out. I've seen children do the exact opposite. I've seen children withdraw be very quiet, be very into themselves. I think we typically think of children really acting out and being angry and aggressive at some points after they've been on visitation. But any time a child's behavior has changed, we always need to remember that behavior is communication, and to think about, why might that child be behaving in a certain way? Is it because of something that has happened in the week that I've seen him or her last? And then to have a discussion with the foster parents about, ways that things can happen to help assuage those issues that come up. But we're also going to touch on that here in a little bit as well.
I think we have one more question that fits in really well here before we move on. And so Mary is wondering if visits with biological parents or siblings are mandatory for children in foster care.
Again, it depends on the situation. Many times, because if we go back and think about the purposes of the Illinois Child Welfare System, and reunification is number one, many times, yes, this is mandated. And of course, it depends on what actually happened to the child, what's going on with the parents. Some parents are immediately incarcerated, so that doesn't always happen. But for a majority of children, the answer is yes, that it is mandated that children have visits with their biological parents. All right, we're going to shift to thinking about the perspective of foster parents, and I thank you for all your questions and comments. You guys have really, really great questions. So just thinking about foster parents, we know that people choose to be foster parents for a variety of reasons. Many times, foster parents aren't given much time at all to accept a new child into their home. And many times they're really not given much, if any, information about the child for whom they are now responsible. And going back to revisit, just what I mentioned a few seconds ago, this is a good time to think about DCFS's primary goals once again. So DCFS has 4 primary goals: family preservation, family reunification, adoption or attainment of a permanent living arrangement such as guardianship, and youth development is really for adolescents and children older than the population we serve. So I really want you to keep these in mind as we talk about the perspective of a foster parent. And FYI, there is a foster parent handbook that is listed on the DCFS website, which is shown on this slide. It is full of great information. I wish I would have this back when I was actually doing direct service in early intervention. I think any information that we can give foster parents to let them know that they do have certain rights, just to give them information on the system, just to remind them about what could happen. I would give them this information and this website. It's really great information. I think we also need to remember that foster care is not intended to be a permanent living arrangement. It provides a way to protect and nurture a child until he or she can safely return home to parents who are ready to regain that responsibility, if that is appropriate. So that's really a lot for a person who is a foster parent to undertake. And I'd like for us all to just remember that. Many times when we receive a referral for early intervention, you may all notice that children who are referred are in relative foster care. And that's because caseworkers must take specific steps to immediately locate parents and relatives for a child who have been removed from his or her home before the temporary custody takes place, which is 48 hours after a child is removed. If there are no relatives located, specific steps are required at 30-day intervals and 60-day intervals for relative placement. And obviously this can impact the stability of a child. Therefore, as a service coordinator and early intervention provider, accepting this information can be very helpful. Instead of being frustrated at the system, being knowledgeable that this is a fact can really give you a frame of reference and information. I know we've had foster children in all of the 3 CFCs with which I've worked, and the service coordinator can go at intake, and it can be a foster care home, and then between the intake and the evaluation, that child can move. And then between the evaluation and the initial IFSP, a child could move once again. I know it's frustrating and it's confusing and it's complicated, but if you stop and think about how frustrating that is for us, again, going back to that perspective of the child, think how that child is dealing with all those changes. So let's go back to our scenario of the toddler who was referred for early intervention. How might that foster parent feel when the service coordinator was asking all the questions that they most likely didn't know? I actually, I did an intake when I was program manager. There were several service coordinators who took maternity leave, so I got to be a service coordinator for a couple months here and there. And I went to this home of a foster parent with a foster child. It was not a relative foster parent. She was actually a fairly elderly woman. She was in her late 60s. And she had been given the child in the middle of the night. And when I came to do the intake, which was several weeks after she had the child, she did not even know the birth date of the child in foster care. And it wasn't really due to anybody's fault. Again, the child was placed in the middle of the night. There was a lot going on with the situation. The foster parent had asked a couple times. She'd asked the caseworker, and even she'd asked several people. But because of the situation, it just wasn't something that she was ever given. And so I thought about, like, this woman had this child for several weeks, and literally, I mean, she had kind of an idea. The child was like 15 months, and I think when she ballparked it, she thought the child was 13 months, and the child was actually 15 months. But when I was sitting there going through the intake and the 474,000 questions that I was thinking I was going to ask this foster parent, and when she didn't even know the child's birth date, that just stopped me in my tracks. And I thought, oh my goodness, I need to just reframe everything that I'm going to ask her, because what she knows is really, really limited. So service coordinators, just think about that for a moment. Keep in mind that they might not have a lot of information, and just do the best job you can to find out as much information as possible. There's also this document. It's called Let Me Tell You About My Child. It was on that previous screen. Thanks. It's tip number 3. So tip number 3 is ask the foster parent for a document. I have never seen this document, but I think if we all collectively start asking for the document from the caseworkers, we might actually start seeing it. It's supposed to be completed by the biological parents to give to the foster parents and the caseworker, so that people caring for the child can know more information. And I know a few slides before the website was put up for the foster parent handbook, you can access this document from that website. So let's all start asking for this document, because I think it would be really important to have. It certainly can't hurt for us to be asking caseworkers for this document. And now, early interventionists, please think about the same thing I asked the service coordinators. So how might a foster parent feel when you're asking questions on your evaluation tool, especially when they don't have much information? I know the foster parent I was starting to ask questions to, I gathered from her that she felt kind of badly that she didn't know more about the child that she was taking care of. But it wasn't her fault. I mean, she was doing the best that she could. She was caring very well for the child. But I just think we need to stop and think about, when we're coming into the foster parents, they just might not have a lot of information. And also, as evaluators, you're going to be forging a relationship with foster parents, especially if the child is eligible and you will be providing ongoing services. Since we all know the first principle of EI is to support families in promoting their child's optimal development and to facilitate the child's participation in family and community activities, you really are in a unique situation of modeling and coaching to help the foster parent and child to bond and attach, and to also promote developmental skills. So let's now think about foster parents who are relatives. In those circumstances, think about an extended family member who has taken in their niece, their nephew, grandchild, cousin, sister, or brother, who may have some negative feelings about the child's biological parents and the circumstances that have surrounded the child being removed. I know that has happened quite a bit. And being a service coordinator and early interventionist can be really delicate in these situations. So tip number 4 is to remember that when you're in these situations, use your skills of listening, which I know you always do, and really remain neutral. That last bullet point, try not to become involved in family dynamics. There have been several situations where relative foster parents really want us as early interventionists to speak on their behalf and get involved in this or that happened because the child was removed. I think it's so important to remember that we really have to remain neutral in those situations. So we're now going to shift to the perspective of foster care from you as service coordinators and early interventionists. We're going to talk about one of those questions from before too. But first of all, I'd like to ask you a question. What first comes to your mind when you think about biological parents who have been involved in a circumstance which results in their children being removed? So take a moment and just think about that. Maybe you want to put things in the chat box. Okay. It's really important for us to be honest with the situations that trigger us.
I'm getting a lot of responses in the chat box, a lot of sadness.
Okay. Yeah, go ahead, Maria.
Oh, no, I was saying that you're getting a lot of responses about sadness and anger, confusion, wondering what happened, you know, wanting to know more, feeling very sorry for the child. So there's a lot of frustration and confusion. So a lot of good responses to that question.
Okay, great. I'm kind of glad somebody put the word anger, because I know I used that word before when I talked about my very first child in early intervention. And I have to also tell you, I felt really guilty for being angry at that mom, because there's no way I could have been in her shoes. It was just so much for me to process. So that's when it's so important for us to be honest with the situations that trigger us. And time again, I noticed when I talk to service coordinators and early interventionists, they want to talk about children in foster care. It seems like those situations and those families really weigh on their minds, and they just have a lot of thoughts and feelings about that. And so, again, I can't impress enough how important our ongoing professional development meetings are with our colleagues. And also, please use your social emotional consultants. They can be excellent resources. And as professionals, I really think it's prudent for us to be involved in ongoing reflection. I do it. I do mine once a month with another social emotional consultant, because I hear all of your stories. All of those stories sometimes resonate with me, and they can also weigh on me. And so I feel it's so important for me just to have another colleague just to talk about like how I'm reacting or how I'm feeling when I felt that story. And it's really been important for me to keep my monthly ongoing professional development. So I have another tip. So tip number 5 is to prepare yourself for one of those ongoing professional development meetings or reflective supervision session. I'd like for you to think about these 5 questions to use in your discussion surrounding a child in foster care. So you can have this handy-dandy little 5-question slide just to think about, number 1, what might the child be communicating with his or her behavior? What are your thoughts about the child's biological parents? What are your thoughts about the child's foster parents? What are the challenges that surround this child? And what are the strengths that surround this child? Just to give you kind of a guide when you're having a conversation about a child in foster care. All right, so moving along, back to the question about providing services. Since the goal of foster care is to preserve and reunify, which we've already talked about, as EI providers, you might find yourself conducting EI services with both the foster parents and the biological parents present. Caseworkers are actually recommending that they're actually supposed to introduce biological and foster parents soon after placement. I haven't seen that happen all that often, but I can most certainly see the benefits depending on the situation. So along with having visitation sessions with the biological and foster parents both present, the foster parents and biological parents are encouraged to do something which is called shared parenting. And with this, family visits are really key to that reunification process. And you as an early interventionist or service coordinator may find yourself in a session or IFSP meeting with both sets of parents present. And so tip number 6 is the following. Remind the foster parents and biological parents that families are the primary interventionists in early intervention, and that the goal of early intervention is to help them learn strategies that they can use during their daily lives. So if the foster parents and biological parents are given the same information and encouraged to carry out the activities that you're recommending, that can make things much easier for the child to have a smooth transition back to the biological parent. They're hearing the same things. And it could be a tricky situation for you to be in visits. I've talked to several early interventionists who have had that experience. They have talked about that it can be quite stressful, but that they always remember that the child can benefit from both the biological parents and the foster parents hearing and seeing that modeling and coaching from the early intervention provider. I'm imagining that those of us who have worked with children in foster care, who have been in the system for a long time, like I said, the average length is 29 months in foster care. Those families have numerous court dates. There are changes to what you're told might happen, changes in caseworkers, changes in foster care parents, many, 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 many changes. And please keep in mind, kind of like I said before, that however frustrating and confusing it is to us as professionals, the children and foster parents must also be feeling that frustration and confusion. So as we talk today about the unique perspectives in foster care, the one most important perspective is going back to that perspective of the child who has experienced something many of us cannot even imagine. By keeping that perspective in the center of our work, it really reminds us why many of us chose to work with children and families, and although it may be very, very hard work, it can also be very, very rewarding. So we're going to just review, and then any final questions or anything that I haven't touched upon. So reviewing what we've talked about this afternoon, you've learned the history of foster care, the statistics, even a new word possibly, that word fosterian, and 3 different perspectives in foster care. I'd really like to thank you all for your dedication to our families in early intervention, especially those who have experienced challenges. And I think it's really important that we remember to take care of ourselves, to reflect on our work, to stay connected with colleagues, and just to remember that we are all in this together. And we can only do our best work when we feel supported. So any final thoughts or comments?
Well, Delreen, there are a lot of comments about just the issue of judging parents, the biological parents, without really knowing the information. So, I mean, there's just been if you've been looking through the chat, there's just been a lot of comments about some of that. Also reminding that a lot of times that sometimes children are in foster care because the parent has a mental illness and they just don't have the tools equipped to be able to handle that. So I don't know if you want to say any more about that. You kind of touched on that sometimes it's not, the parents make the choice to put their child in foster care, but sometimes the child is in foster care not by choice, but because the parents just don't know what to do.
Yes, very good point. We've also had, throughout the counties that I work with, several parents who have intellectual disabilities and have had children placed in foster care. And those are so hard. We've had several situations where early interventionists and service coordinators have worked with several families for a year or more, and then the children got removed because of the mental illness of the parent or intellectual disability of the parent. It has just been, I can't tell you how difficult that's been, because I think the service coordinators and early interventionists really thought that the parents were doing the best that they could do, but then the question of safety came into play, and in several circumstances, the children were not in a safe environment, and those were just gut-wrenching, just really heartbreaking situations. So yes, definitely, I'm glad whoever brought that up, because that's definitely another situation that we can encounter quite a bit in early intervention.
There's there's several questions, so I'm just trying to kind of read through them all, but this one is from Jennifer, and there may be another question from someone else that relates, but it has to do with when you're working with providing early intervention services, or even an IFSP meeting, with both the foster parent and the biological parent. So you've developed this relationship with the foster parent, and help them to see the benefit of early intervention, and now you're involving the biological parents who don't have any kind of buy-in or don't trust that. So are there suggestions for providers who are faced with those joint meetings in those situations?
Sure. And those are tough situations to be involved with, because most likely providers have developed a relationship with the foster parent and might be thinking of some not so positive thoughts about the biological parent. And, in those situations, I think we always just need to go back to our, our professional ethics and development that, and in these circumstances, I always go back to the child. Like if I'm sitting in a situation in a meeting and I'm feeling conflicted about what's going on with the adult, I always go back to, we need to center on the child, and we need to be concerned about what's in the best interest for the child, and try to engage all members, both foster and biological parents. And again, that can be very, very tricky. And if there's at any point, you need to speak to someone, I would consider those would be a great time to bring in, call your social emotional consultant at the CFC and just get some ideas on that exact situation, just to get a different perspective on things.
Okay. There is some information or some questions about approaching the DCFS caseworker to get more information about the child. Also related within the question from a couple other folks is if there's protected mental health information. So any other strategies on how to get more information beyond just asking the foster parents for that document?
Sure. Actually, every Child and Family Connections office has a DCFS early childhood liaison. I'm connected very closely with the ones. There are two in the areas that I serve. And so if service coordinators or providers are having an issue, I mean, sometimes we know that a foster child moved, and not blaming anybody, but it might be 2 weeks before we have heard where their new address is. The CFC can use their DCFS Early Childhood Liaison, and those folks can look up in the system, and their system is updated nightly, so they can tell us very quickly where a child is residing. We've had some situations just with DCFS systems kinds of things that those folks have also been very helpful. Their role is to make sure that DCFS wards get the most appropriate early intervention services and early childhood services, but we can use them for early intervention, and they have been great resources. So if you don't know who your DCFS liaison is, I'm sure your CFC knows, and typically those telephone calls and those contacts typically go through the service coordinators or program manager or social emotional consultant, but I know our DCFS liaison also speaks to early intervention providers in our area. And then also the question of mental health, mental illness, protected information, definitely. There is definitely some information that we might not ever know about what has happened, or situations involving the biological parents, and that's just a fact of the systems that we work with and the protections that are that biological parents can have. It's interesting though, if we do have relationships, or do get relationships with DCFS caseworkers or private agencies that are subcontracted with DCFS, that's another one of those things. Relationships are so important. It's amazing to me to see the times where we have relationships with those certain agencies who are over foster care, and they get to know us, we get to know them. It seems like it just becomes so much easier. It's again, going back to, it's all about relationships. But the question, there definitely could be some protected information that we might not know about.
Sounds like a good opportunity for a provider meeting to invite the local DCFS CI liaison and get to know them a little bit better. We have time for a couple more questions, but I'm going to advance the slide to the resources that Delreen has so that you can be looking at those while we're dealing with the rest of the questions. There's a question about how many times or passes do a biological family get when they are a no-show for visitation? And how is that documented, and how does that impact that situation?
So that would be an individual situation based on the judge and the state's attorney and what actually happened. I've seen situations where families have no-showed several times and continue to get visitation, and then on the other hand, I've seen the biological parents, no-show a few times, and consequences have happened. So it really depends on the individual situation of what happened for that child to even be in care. Great question.
Melinda would like to know if a child is if a child's in foster care, can they automatically have a referral for an EI evaluation?
So I mentioned there are DCFS liaisons. So every child who is an intact, who actually doesn't go into foster care, but there is a report made on them, but they're kept with the families. All of those children are screened by developmental screeners. And then for children in foster care, those DCFS liaisons I was talking about make referrals all the time. And they also do developmental screening. So when a child is taken into care, in the first 30 days, a child has to have a developmental screening. We do receive referrals in the 3 CFCs that I work with quite often for the reason is that the child was taken into foster care. However, there's usually always another component of some sort where it might be a gross motor delay, obviously a social emotional delay, a speech delay, but there can be a referral made just for that purpose, and that's when we would bring in a psychological services evaluator to be able to find that child eligible if there wasn't another developmental concern.
Okay. I'm kind of looking through. There's a question about resources related to, are there books or social stories available to help to use with children to help explain what's going on? Does anything come to mind right away?
Yes, there are some really great stories, like children's stories about, Bobby is in foster care. That's not the title, but I can't think of any titles. If you Google children's stories dealing with foster care, there are definitely several that you could use in your therapy sessions. That is an excellent idea. I'm glad whoever asked that question brought that up. So that is definitely a resource to be able to use. And again, that's one of those things. I think it's so important for children to know that they're not alone and that other children, have gone through what they're going through. It just gives them an opportunity to realize that they're not as different as they might be feeling.